we've got in the shoulder joint is an anterior glide. So traditionally this is going to be for somebody with an external rotation limitation. So for this one, you can do it a couple different ways. I like having the patient on their stomach because I feel like it stabilizes the proximal part of the joint a little bit better. So for this one, I'm going to take the patient. Again, you want to try to get them into that loose packed position. So you're going to have to get down a little bit. You want the patient to be as far as they can over to this side of the table so that you can get them into a little bit of that abduction and flexion. I'm going to stabilize here. Again, meaty part of my hand as close to the joint as I can get. And then I'm just going straight down. So same idea here as we talked about with the posterior glide, that you're going a little bit laterally. Same thing here, I'm going to go a little bit medially with it. Okay? And I remember talking to somebody in the course, and it's worth noting, and this is a point with any joint, but especially with the shoulder, when you've got somebody, so we talked about pain dominant versus a stiff dominant patient. When you get these people that are very stiff dominant, meaning they're not real irritable, don't be afraid to move out of that open pack position and get them closer to the position of the restriction. In other words, if somebody, I'm deciding I'm going to do an inferior glide on somebody to get more abduction, and the person's good here, their restriction is here, I'm not going to be afraid to start to take them up to that point of restriction, maybe a few degrees below it, and mobilize